Okay, so good evening, everyone. Welcome to Therapy Ed's online office hours. I am Regina Lehman, and I am your instructor, your host for this evening. And this evening's topic is CVA and traumatic brain injury. I'm going to share my screen, and we'll get started. Yeah. Okay. There we go. Okay. All right. So as I said, this evening's presentation is going to be on stroke and traumatic brain injury, or TBI, and we're going to be talking about OT evaluation or assessment and intervention approaches. And as I said, my name is Regina Lehman. So if I look a little distracted for the next couple of minutes, it's because I'm still admitting people to the room. All right. Okay, so please, just, matter a little bit of business. Please make sure that you are compliant with the copyright regulations. This session and all of the materials that we're going to be showing you, I'm going to be showing you, are copyrighted and the property of Therapy Ed. So please do not audio or video record. Please don't take pictures or screenshots, or, don't share this information. If don't take screenshots and then share it, is where I'm going with that. Sorry about that. So we take that very seriously. Just so you know, this recording is also going to be available on the Therapy Ed YouTube channel if you want to watch it. But please make sure that you are adhering to ethical standards and copyright. Okay, so please make sure that your mic is muted during the session. If you have a question, please raise your hand. I will try and monitor hands raised if you have a question while I'm speaking. If it seems like I don't see you, you can unmute your mic and say, "Excuse me." But I will have room for questions at the end. If you are asking a question, we do ask that, if possible, turn on your camera so I can see who I'm speaking to. As I said, tonight's session will be recorded and posted in a couple of days on the Therapy Ed YouTube channel, and then it will be available for about a month. Only the PowerPoint is going to be presented. So once we're through the PowerPoint and we're entering the Q&A, I'm going to turn the recording off. That's not part of what gets posted on YouTube. So there are still some videos not posted on YouTube. I think that we are probably running a little behind. A lot of focus has been on getting the new editions of the books together. And of course, conference is coming. So I will find out if I'll kind of goad them a little bit to say that that you're looking for the videos. Okay, thank you for letting me know that. I appreciate that. You can use the chat box. There is no co-host. So again, I'll get an alert that there's something in the chat, and I'll try to monitor that the best I can while I'm talking. All right. Keep an eye on the chat. Sometimes your question is a question that's been previously asked. So you can help me and I'll help you. That would actually be a very nice way to run the session tonight. Okay, so there's still more people coming in. All right. Let's go there. All right. So what I'm going to be doing is talking about must-know information. And if you've taken the Therapy Ed review course, you know that that's something that we say throughout the course. This is information you must know, which means from our experience and that this information is definitely on the NBCOT certification exams, both the OT and the OTA. So the information can be found in the review and study guides if you have them in chapters 7 and 12. And it's the same for the OT and the OTA, and it's the same for the OT 9th and the new 10th edition. So I'm not sure what edition you all have. if you're an OT student or grad, if you have the 10th edition yet, or if it's just becoming available. I know it's recently just becoming available. All right. So here's the things that you have to know, right? You must know the types of CVA. And what do you think I mean by types of CVA? What do you think that means? And you can just unmute and shout it right out.
Ischemic or hemorrhagic stroke.
Okay, great. An ischemic stroke or hemorrhagic stroke. So what is the difference there between those two?
Ischemic is like a blood vessel blockage somewhere, or particularly in the brain, and then a hemorrhage is a brain bleed, or the blood vessel popping.
One moment, hang on one moment.
Okay.
So I apologize, my dogs are barking at something going past. So sorry if that's distracting. So you're correct. An ischemic stroke can be a small blood vessel, right? So ischemic means that there is cell death, right, in the brain. What's a hemorrhagic stroke? Yeah.
30 seconds for an hour. Yeah. But it's
Wait, I'm sorry. Go ahead. What's a hemorrhagic stroke?
Oh, that's like if a blood vessel pops in the inside of the brain. So it's just like a brain bleed.
It's right. So there's a hemorrhage.
Yeah.
Right, as opposed to a pimp. Good job. Great. What about a TIA? What's that?
Transient ischemic. Is that a? Oh, yeah, you got me on that.
You got it, Hunter. You got it.
A transient ischemic.
That is for attack.
Attack. Yeah, you got me on that.
Correct. So that's what also a mini stroke. So understanding the etiology and specific types is really important, because you need to know if, a hemorrhagic stroke tends to be diffuse, which means a large area could be affected. An ischemic stroke often is a pinpoint. A TIA is very specific. It can be just small amounts of cell death in the brain, but multiple TIAs can result in a pretty severe presentation of a cerebral vascular accident. And thinking about a CVA or a TBI, the systems that are involved, the primary system is the neurological system. So that is going to help to guide us when we start to think about what kinds of assessments might we need to do, what kind of practice model or approach might we take with these kinds of conditions. So I know I'm kind of giving you a little bit of, clinical reasoning there, really thinking about that procedural or scientific reasoning that would drive. Understanding what's involved in this condition is really important. So once we've established the types of CVAs, we have to think about the brain. So really understanding the neuroanatomy to a certain extent is really important. And when I say neuroanatomy, if I have a stroke in a certain portion of the brain, I'm going to be thinking about, well, what functions does that portion of the brain control? So really starting out with right versus left side, understanding what the two sides of the brain do. And that is on in table 7.3 or 7-3 in both the OT and the OTA review and study guides. And it gives you a really nice breakdown in terms of specialization. So you know that if there is damage to the brain on the left side, then it's going to be the right side of the body that's going to have the most be the most affected. And conversely, if you have a injury to the brain, whether it's a TBI or a stroke, on the right side, it's the left side of the body that's going to have the manifestations or be the most affected. Right? So understanding what does the left hemisphere of the brain control? What are some of the primary things or primary functions that the left side of the brain controls? And I always think left language, just L. So because Broca and Wernicke's areas are on that side of the brain. So we might expect with a left-sided brain injury that the person would have some difficulty with language. So really understanding the differences in expressive and receptive aphasia. So I'm sorry about the cough. So knowing what terminology also goes with these diagnoses is important. So aphasia, being able to either produce or comprehend oral or verbal auditory information. I'm thinking about verbal processing, being able to put that together. So the aphasia piece, and also thinking about motor praxis in terms of left-sided injury. The other thing I also think about is, hemianopsia. We could have a right hemianopsia based on a left-sided brain injury. Conversely, on the right hemisphere, I'm sorry. I apologize for the disruption. Yourselves.
Claro, es que la Tania, la Lupe le deja la casa ahí para que le dé limpiando y le quita.
Hello.
Y
Can
después
everyone
cuando-
please mute?
Dice la Lupe sentado.
Thank you. I appreciate that. All right, when we're thinking about the right side of the brain and injury there, I tend to think about emotional regulation. I think about lability, emotional lability. I think about also some idiomotor relational apraxia, so think about apraxia. And the ability to comprehend abstract information. So really understanding those two sides and the hemispheric specialization is really, really important. And that would apply both to a CVA and to a TBI, right? Because both involve brain injury. I'm going to move a little bit forward to really thinking now about traumatic brain injury or TBI. You should know the types of TBI, right? So there's an open head injury as opposed to a closed head injury, blunt force trauma. I'm thinking about concussion, so repeated blunt force trauma to the brain, and that could be inside the skull. Really understanding again, right versus left side, and then if someone has a TBI and they become unconscious and they're in a coma, the coma scales are a must-know piece. So please go over your Glasgow coma scale and understand, what those
Number one. Alex is all about being the winner right now.
Okay. Understanding what the responses are there as someone emerges from coma. And again, the Ranchos Los Amigos scale, you have to know the levels. Sometimes in an exam item, they will tell you the level, the Ranchos level. In others, they're going to give you kind of symptoms. So you're going to have to remember, what does that mean in terms of what can I expect that person to be able to do, and what would my most appropriate interventions be at that point? So those are in tables 7.4 and 7.5 in both chapters. And they're really very thoroughly presented. Okay. When we think about, so, you know, numbers 4 and 5 here are about approaches or about considering what practice models, what theories would apply most appropriately to these diagnoses. And when we're thinking about CVA and TBI, we're really thinking about the central nervous system. We're thinking about how an injury to the brain would affect motor performance. So we're looking at neurological and physiological systems here and their connections. Right? And when we're selecting a practice model or theory, you know, or looking at the evidence, what we're thinking about is what is the most effective to address the systems that are hindered or are impacted by these conditions. So understanding the principles of motor learning, that is probably the most recent research, and that kind of brings together a number of traditional sensory motor approaches into one and contextualizes it. So if you look at table 12.1 in your review and study guide, you get a sense of exactly what we're thinking about. And we're thinking about motor performance within a context. We're thinking about motor performance that can be generalized from one context to another. And we're thinking about occupation-based performance. So that is a big piece of the motor learning principles. Really thinking about a systems model of motor control, really thinking about the integration of the neurological and the motor systems, and how the environment and even your sensory systems impact your ability to perform a movement. So as I said, there's a lot of context there. And what we're hoping is that the client will move and then be able to generalize that movement to other similar situations where that movement is required. The traditional sensory motor approaches are the ones that kind of have were very controversial and very new when they first came out, a new way of thinking about particularly stroke. So I'm talking about NDT or neurodevelopmental treatment. I'm talking about Brunstrom. I'm talking about PNF. I'm talking about Rude. Talking about those approaches. And in table 12.13, it gives you a comparison of those traditional approaches and kind of their key strategies. The one thing that is not there in between motor learning and traditional sensory motor approaches is constraint-induced therapy. So that's another consideration and is a common approach utilized in many places. I'm looking at the chat and it says when it comes to TBI and the client is level 2, some include giving a gustatory stimulus. Hang on a second. Oh, okay. With a lemon swab on salty and sweet, right? Or is ammonia, vanilla? Ammonia. Vanilla extract. That's a really good question. I have to think about that. Let me get back to that question. I just saw that it popped up in the chat that there was something there. So I'm gonna hold that for after I finish this, if that's okay. Elena. Okay, I won't forget that it's there. All right, so, okay, all right. So when we think about selecting assessments, when we think about interventions, we're thinking about what approach are we utilizing here? But all the approaches should be neurological and neurophysiological based, right? We're not looking at a lot of biomechanical intervention here, because we're not looking at strength. We're not looking at it from that perspective, range of motion. We're looking at movement, and we're looking at the integration between the neurological and the neuromuscular systems. Okay. All right. So I am going to, here's the question of the week. I'm an OT practitioner. I'll talk a little bit also about some safety issues before we move on to questions and answers. So an OT practitioner is working with an adult recovering from a left middle cerebral artery stroke, and the client has difficulty brushing their teeth and hair due to ideomotor apraxia, and they would like to groom independently. So what intervention approach is best for the practitioner to use with this client? So some of the things I mentioned, you should really go back and look at aphasia, look at dysphagia, look at apraxia, all of the terms that kind of are intertwined with understanding stroke and TBI. So for this client, what we would do is provide hand over hand. So we're thinking about, if we're thinking about a motor learning approach, we're thinking about movement that is guided with sensory input within a context. So I would also say that this should take place within the context of where this person is going to be doing grooming. So tactile and kinesthetic input. The other thing that we are providing is we are providing the movement pattern and practice with a typical movement pattern. So that's also something to be considering. Okay. All right. All right, so just a little bit again of bookkeeping, and then I'll open up to questions. The question of the week is posted on our social media stations or our social media platforms on Thursday. And then the answer is posted on Sunday, and then it's gone over on the following Tuesday within the online office hours. I'm going to... Okay, so what we like to emphasize is that, there's two aspects to getting ready for this exam. And having a study plan is a really important part of that to help support your ability to master exam content. And the other thing is really thinking about how to analyze the exam items, right? To determine what actually this question asking me and how do I arrive at